let's talk about a very important topic, that is mental status examination. So examination of psychiatric patients, what examination we do? MSc. So from the name we can understand we are assessing the mental status of the person. So the first important detail or the heading which we see in MSc is the general appearance and behavior. So suppose we are sitting in the OPD and the patient walks in the room. So our examination has already started. So in general appearance and behavior, let's understand what are the important headings which we cover. First is we observe the build of the person. Now build can be of three types. The person can be thin built, the person can be muscular, and the person can be obese. Now suppose a 16-year-old female walks in the OPD and she is very thin. So any diagnosis coming to your mind? Any eating disorder especially coming to your mind? So yes, the person may be suffering from anorexia nervosa. In fact, we'll talk about anorexia nervosa. We'll discuss that in anorexia nervosa, the weight, the BMI is low. But don't do this, that you see a thin female, a young thin female and you say she's having anorexia nervosa. No. We'll make a diagnosis when we take a detailed history and do proper examination. But this is giving us certain hints, certain clues towards certain diagnosis. Similarly, let us say a 20-year-old female comes with certain eating disorder. So any eating disorder which may come to our mind? Yes, the person may be having bulimia nervosa. We'll discuss in bulimia nervosa, weight may be normal or may be increased. Other eating disorders such as binge eating disorder. Even in binge eating disorder, we'll discuss the person may have increased weight. So these are giving us certain clues towards the diagnosis. Also, this may help in the management. For example, we'll discuss schizophrenia, which is a psychotic illness. So schizophrenia, which is a psychotic illness, we treat schizophrenia with drugs. Which drugs? We give the patient antipsychotics. When we'll cover antipsychotics, we'll discuss that certain antipsychotics have a side effect that they can increase weight. So suppose a patient who is obese and comes to us with schizophrenia, would we give any drug which already has a side effect of weight gain? No. So we would avoid such drug. So this may also help in the management. Then second heading under the general appearance and behavior is the dressing of the person. Dressing usually we see with respect to the weather condition. So whether the person has dressed appropriately according to the weather or not. For example, you're sitting in the OPD and it is 40 degrees centigrade outside, very, very hot and humid temperature. You have switched on the AC, wearing very thin layer of cloth in the OPD, and a person walks in wearing so many layers of clothes, jacket, muffler, gloves, everything. So is it appropriate dressing or is it inappropriate dressing? So this is highly inappropriate dressing. The dressing is not appropriate to the weather condition. Again, this is giving us some hints that person may be suffering from certain psychotic illnesses. For example, schizophrenia. So patient may be suffering from schizophrenia, which is a psychotic illness. So again, just by looking at the dressing will not come to the diagnosis. We'll take a detailed history in MSc, but this is giving us certain hints that person may be suffering from schizophrenia or a psychotic illness. Then next heading which we see is grooming. Grooming means self-care. So all of us maintain a good grooming. We take care of ourselves, take bath regularly, maintain good hygiene. Now suppose we are sitting in the OPD and a person walks in with uncombed hair. There is foul smell coming from the body as if the person has not taken shower for so many days. There is dirt all over the body. So this person is having good grooming or poor grooming. So the person is having poor grooming. Again, poor grooming may suggest that person may be having some severe illness. The person may be having some psychotic illness. For example, schizophrenia. So these may give us certain hints towards the diagnosis. Also, this may tell us the severity. Two patients A and B having depression. Patient number A comes with normal grooming. Patient number B comes with poor grooming. So whom do you think may be having a severe depression? It may be patient number B. So this may also help us to tell the severity of the illness. So this is grooming. Now the next heading is the motor activity. We see how is the motor activity. So suppose a patient walks in the OPD and is having increased motor activity. He is not sitting at one place, pacing around, running around. So the motor activity is high. Again, motor activity may be high in certain disorders such as mania. So we'll discuss mania is a mood disorder in which the motor activity is high. The person's mood is elevated, the motor activity is high. In fact, even in child psychiatry, we'll discuss one important disorder, that is ADHD. Attention deficit hyperactivity disorder. So here also we see that the child is not able to sit at one place, running around, very fidgety. So motor activity is high. Sometimes we see that the motor activity may be low. So the person is walking very slowly, moves very slowly. So there is a decrease in the motor activity. Again, in certain conditions such as depression, depression is also a mood disorder in which the person's mood is low, the energy levels are low. So the motor activity may be reduced. Now lastly, we also see the attitude of the patient towards the examiner. Now sometimes we see that the patient is highly cooperative. Whatever questions we are asking, the person is telling us the answers, is seeking help. So he is very cooperative. And we see that generally patients with neurotic illnesses, with neurosis, may be cooperative. We'll discuss what is neurosis, what is psychosis. And sometimes we see that the patient is uncooperative. The patient may evade our questions. The patient may just deny, I don't want to answer. Or when we are asking the question, the patient is looking here and there. So the patient is not cooperative. And again, in psychotic illnesses, at times we see that the patient may be uncooperative. For example, in schizophrenia.